So we are talking about outpatient essential accident and sickness. And it's an insurance policy that pays cash directly to you to help pay out-of-pocket costs when you suffer an accident or sickness and you require outpatient surgery or treatment. What would happen if you suffer an accident or sickness that requires outpatient surgery? Could you still pay your bills? That's the first question. Outpatient Essential pays cash directly to you to use as you wish to help pay unexpected expenses or everyday bills so you can focus on your recovery. These policies can pay up to $4,000 per year, $1,000 per each surgery to a maximum of 4 surgeries per year. You decide between both accident or sickness, accident only, or sickness only. So accident policy and sickness policy are 2 separate policies. So the person has to purchase both if they want. First, we go to qualification, the same that we did. We go and we read it through because there are something here that you never even thought the person may have. So we go heart attack, angina, arterial fibrillation, congestive heart failure, coronary artery disease that requires bypass surgery, a stent, or angioplasty or heart valve replacement. So stroke, TIA, cancer, melanoma, Hodgkin disease or leukemia, multiple sclerosis, cystic fibrosis, muscular dystrophy or Down syndrome, alcoholism or drug addiction, diabetes which requires insulin or diabetes which was diagnosed prior to the age 40. The most important thing is for critical condition, this one is 35. Be careful about that. And also HIV and AIDS. So if you have not had any of these, then this policy, if you suddenly suffer an accident or sickness and you receive outpatient medical treatment, even if you're never admitted to hospital, you may need help paying your bills, right? So what it does, it pays $4,000 per year for outpatient surgeries based on 4 occurrences per year. Pays up to $800 per accident or sickness for up to 20 prescribed rehabilitation treatments like speech, occupational, and physical therapy. Additional reimburses up to $200 as a lump sum for prescribed medical appliances. Cover you in any accident, whether on a motorcycle, boat, ATV, or any recreational vehicle, hunting, fishing, or participating in any sports or recreational activity, fire or smoke inhalation. And it also protects you during any surgeries due to sickness, such as pacemaker procedure, upper gastrointestinal endoscopy, cataract surgery, skin graft. Cover you regardless of your occupation or hobbies, 24 hours a day, 7 days a week, 365 days a year. Just think of it, right? It covers you all year. It pay cash benefit in addition to benefit provided by any other insurance policy if you have. For example, workers' compensation, any kind of government employment insurance programs. Just think of it. It's a very, very good program. So the Outpatient Essential Accident and Sickness Plan covers you in 3 important ways. The first one is outpatient surgery up to 4 surgeries per 12 months period, and it pays $500, $750, or $1,000, or it pays plan 1, 2, and 3. We will pay you up to $1,000 per surgery if you are a family member requires outpatient surgery, right? If you have a family plan. And also it has a rehabilitation therapy, up to 20 visits per accident, 20, 30, 40, and we will pay you up to $800 for your doctor prescribed rehabilitation therapy. This includes physical, speech, and occupational therapy treatment. And having said that, its medical appliances also get covered, which are $100, $150, $200. We will reimburse you in cash up to $200 for the purchase or rental of medical appliances like ventilators, crutches, wheelchairs, walkers, nebulizer, etc., if prescribed actually by doctor. So the doctors should have asked you to do that with family plan coverage and within 90 days of accident. So if the accident happens 2 years ago and today you come and ask for something, sorry, we cannot pay, right? And also it has it can be each one of the plan, and also if you have a family member, then we can give your whole family as a family plan, and it covers you with 28% of the premium, which is going to be a better price. Benefit of family plan is protects you, your spouse, and your eligible children. When you have more children, they are covered from the day they are born. It's guaranteed coverage for your spouse and children. This means at age 25, when coverage ends for each child, your child may continue coverage by purchasing a new policy. For example, if the kid had developed some kind of sickness, because they had this policy for a lot of years, then they can purchase without evidence of medical tests or anything like that. Although, let's say they develop some kind of, I don't know, heart problems or any kind of blood problems, still they can get this policy for themselves because they had a policy. But they have only 30 days to make that changes.